Let's start by analyzing the assessment of a child with a suspected abuse, maltreatment. And when we have to examine a child being victim of abuse, we have to make sure to avoid any new trauma. And so we have to be welcoming and to create a calm place where we can carry out our examination. And before it, we have to explain to the child what we are going to do so that we can build trust. And during the physical examination, we have to analyze several aspects that can help us in identifying the case. We have to look for skin injuries, functional limitations, evaluate the neurobehavioral development. And also we have to analyze his feelings to make sure that he is not depressed, or maybe to spot or to look for some disinhibition or sexualized behavior, or to see if he or she has regressive or aggressive behaviors. And then our global assessment shall be made about the patient. So we have to evaluate several minor aspects that can help us in identifying the case, such as clothing, hygiene conditions. We can therefore understand what is the family condition, for example, and then maybe we can spot a pale skin, for example, already from the look or from the dystrophic aspect of the child. We can have information about malnutrition or poor hygiene that can lead to a dermatitis, for example. And then we have to assess the child's weight and height and head circumference in a child under 2, because an inappropriate growth can be a sign of neglect. And if the head circumference is growing, that can be an hemorrhagia, intracranial hemorrhagia. And then as for the regions, we should remind the acronym 10-4, and according to the American Association of Pediatrics, we have to remember these regions. So the trunk, the ear region, and then the neck. 4 stands for children under 4 years old, or babies under 4 months of age. Here we have a case where we see different type of lesions. The inner arm you see on the hips, neck, with some bruises, and face. Then we have to consider the age of the child, because when you find bruises, like in this case, both sides of the face, so bilateral bruises on this baby who is 9 months old, so is not able to walk or to have such an activity to create such bruises. So immediately we have to suspect for an abusing condition. So in general, under 6 months of age, in case you find bruises on the subject, you always have to suspect abuse or neglect. Other types of contusions can be those caused by natural means, could be slapping, smacking, punching, kicking, pinching, and they can leave marks, for example, the handprint on the face. This, for example, you have some scratches here, or general marks in, or there are some other instruments that can leave marks. Could be the sole of one shoe, or for example, other types of spatula or any other instrument, or another mark here it's left by a belt or a rope that can leave this mark. In this case, for example, here you had the mark of a broomstick, so a linear lesion. If you, for example, apply a meter next to it, you can take a picture by understanding what is the mark size. Here, this is another case of trunk lesions, shoulders, and to the face. And this is a younger child. You see some scratches. The marks that are left by scratches can be on the surface or deeper, and they must be recorded and documented with all the other elements. Sometimes we can face lesions, surface lesions that are linear and parallel, and it happens in the emergency care. Maybe children coming for other reasons, but then you can see, if you see such lesions, you have to conduct an investigation, because they are self-inflicted lacerations. So of course it means that the child is living a significant condition. Then we have burns. So abuse burns, they are the so-called glove burns, because they are inflicted mainly on the extremities. They can show different levels of severity, and they can concern the surface part of the skins. But in the child, they can be very important, because the proportions of the body are different. So they can have a clinical picture, an important clinical picture. This is the immersion burn. So it is usually a punishment. It can affect the upper limb or the lower ones. And so they are different from accidental burns, like the child is touching maybe a boiling liquid or a plate full of boiling broth, or close to the coffee machine, and then you see the burns here show irregular edges, and the size of the injury is really irregular, it's smaller. Then there are other types of burn marks linked to objects that can leave the mark, the perfect mark, on the body. For example, could be the hot plate or lighter or forks or cigarettes that can create such circular lesions.